Welcome to another segment of Senior Talks, an exciting new educational program for those age 45 and older in the Harris County area. Senior Talks features presentations on opioid use, medication management, recovery, and overall health. Senior Talks is sponsored by the Harris County Area Agency on Aging and the Council on Recovery's Wellderly program. Today we have Rossana Ishee, our older adult specialist for the Wellderly program, here to speak to us about opiate use in older adults. Take it away, Rossana.
I want to start by saying that along with the topic of opioid use in older adults, there's the matter of chronic pain. For example, arthritis, cancer, neurological diseases, and other illnesses that become more common in later life call for the use of pain medications. And so what can happen is that most older adults end up abusing prescription drugs unwillingly. After all, they do take more medication than any other age group for health issues that occur, especially as one ages. In fact, 33% of those between 57 and 85 years old use 5 prescriptions on average, which of course can lead to a risk of mistakes. One route to opioid misuse and overdose death can begin with excessive prescribing of the pain medication, and continued use of prescription opioids can lead to opioid use disorder. For some individuals, as dependency grows on these pain medications, it may even evolve into the use of heroin, which is cheaper and more accessible, albeit illegal, opioid. Opioids, which are also known as pain relievers, have become the second largest substance that older adults are misusing and or abusing, alcohol being number 1. Opioids work on opioid receptors on nerve cells in the brain and nervous system, relieving the pain. And it gets rid of the pain, which of course causes one to feel better. To point out how widespread opioid use is, of the 20.5 million Americans who had a substance use disorder in 2015, 2 million had a substance use disorder involving prescription pain relievers, and close to 600,000 had a substance use disorder which involved heroin. Many older adults take opioids for long periods of time, which creates a tolerance for the drug, believing that they need more and more of the drug to reduce the pain. And it's not even so much that they believe they need more, they actually do need more because their bodies have become accustomed to the pain medication. So what may have worked initially no longer works for the patient. Older adults aren't immune from the opioid epidemic that is sweeping the U.S. Older adults especially have unique backgrounds, vulnerabilities, and needs. Many also feel ashamed to seek help for problems with prescription painkillers like Oxycontin or street drugs like heroin. Across the board, the relative risk of addiction is constant for adults. The difference lies in individual response. When given an opioid drug, most people will feel some nausea and physical discomfort and wake with an unpleasant sensation, but about 20% of the population will say they feel great. Those are the ones we worry about. And you're just as likely to run across those 20% in older age as you are in younger age. With 65 million Americans now 60 years or older, this adds up to a significant number at risk. Years of chronic pain treatment add up. The medical community is waking up to the need for greater caution in prescribing opioid painkillers. According to new guidelines, for most patients, these drugs should be used for short periods only. To ease acute pain, like after surgery, for example, and as a last resort for hard to treat chronic pain. Yet that doesn't address those older adults who've been prescribed these drugs for decades. Also, it's never a good idea at any age to take sedative and opioid drugs together. However, patients seeing multiple specialists for different medical conditions may accidentally receive these dangerously addicting medications through oversight. Older adults are more prone to risks such as respiratory depression from both types of drugs. This is problematic for someone to stop breathing from being on the combination. Older adults who are already more prone to falls, broken bones, and cognitive impairment increase all of these risks with opioids. Just to give an idea of the powerful effects of opioids, they are what's called a Schedule II class of drugs, which include heroin as well as the legal prescription pain relievers such as oxycodone, oxycontin, and Percocet, hydrocodone, Vicodin, codeine, morphine, and fentanyl, just to name a few. These controlled substances are classified as Schedule II by the federal government because of the high potential for abuse, whether it be psychological or physical. Some of the warning signs to look out for with substance misuse is when one is excessively worrying about whether the drugs are really working, or when one is worrying about having enough pills or whether it is time to take them. One almost becomes hyper-focused, if you will, on taking the medication. Also, another sign would be when one is constantly complaining about doctors who refuse to write medications for these types of drugs. Also, another sign can be self-medicating by increasing doses of prescribed drugs that one feels aren't helping anymore, or even supplementing prescribed drugs with over-the-counter drugs. Especially with regards to opioids, pain management classes can be beneficial in helping the patient understand the goals of therapy, pain management assessment, and appropriate use of the medication. If you or someone you know needs help or further information, please reach out to us at the Council on Recovery or call the Wellderly program. The information will be on the screen. This concludes my presentation. Please stay tuned for our next segment of Senior Talks. Thank you.